Hello and welcome to How to Skip the Cataract Surgery Queues Following Lockdown, brought to you by Mr. Samer Hamada of Eye Clinic London. I'll be your presenter, Rod Solar. Mr. Hamada, would you like to say hello?
Oh, hello everyone.
Hi. Well, let's get started. So, who is Mr. Samer Hamada? He's a consultant ophthalmologist and a private cataract surgeon. He's a world-renowned surgeon with specialist training in cornea and refractive surgery. He's treated thousands of patients, providing them with professional and tailored care that achieves excellent results and improved quality of life. And his team of highly qualified surgeons are experts in vision correction. Now, I've known Mr. Hamada for over 2 years, and I consider him one of the most caring and skilled cataract surgeons in London and perhaps beyond. He's treated my wife for her dry eyes, and she's very happy with her result. And that's one of the reasons why I'm here introducing this content with Mr. Hamada so that we can help you skip the cataract surgery queues. So, this is the main reason we've invited you to visit with us today. The NHS performs 30,000 cataract operations every single month, and they do them very, very well. There is typically a waiting list of 18 weeks, but now that's all changed. Due to COVID-19, the NHS has canceled elective surgery on April 15th. The NHS does not intend to resume that canceled surgery for at least 3 months since shutdown. When elective surgery resumes, waiting lists will likely grow even further due to social distancing. And for those whose cataracts are not removed in time, the long-term effect can be loss of sight. So if you want to get your cataract surgeries, done sooner, then you'll have to think differently about how you go about getting the procedure. Now, private cataract surgery might be the answer for you, but there's no need to decide right now. The whole purpose of what we're trying to do today is to let's see if you are an ideal candidate, but we'll do that virtually in this space now to see whether or not this is the right thing for you. Now, first, you may need to decide if private cataract surgery makes sense for you. And the patients who choose to go private are the type that want to avoid long waiting lists. We're going to see not only the waiting list that we are accustomed to experiencing with the normal process of waiting, but we're going to see those waiting lists expand. Those patients who want to have a tailored treatment with a premium lens, in other words, they want to get rid of their glasses, they want to be free of contact lenses, they want to see clearly at all distances, whether they're reading a book or whether they're watching television or whether they're driving a car at night. They want to become spectacle independent, and they want to fix their astigmatism. So astigmatism is one of those things that patients complain a lot about after regular cataract surgery, because the monofocal lenses that surgeons put into patients when they have cataract surgery on the NHS does not address the astigmatism. So they walk out and they still have to wear glasses to correct that astigmatism. They want to choose an expert surgeon. Now, the surgeons that work in the NHS are all very good. But if you want to choose the specific surgeon after reviewing their background, their CV, talking to other patients, then you have a much better chance of doing that if you decide to go private. And these patients want to see their surgeon throughout the whole patient journey. So they see their patient before the surgery, obviously at the surgery, and then after the surgery as well. And they'll only be seeing that particular surgeon that that they've elected to choose. They will never see a student surgeon, for example, who's doing cases being supervised by a more senior surgeon. And they want access to world-class facilities. So the kind of facilities that really spare no expense at ensuring that you get all the tests that you need, that you are completely equipped to have all your choices in front of you, and then there's absolutely no compromise on the types of lenses that you might be able to choose from. So why should you consider private cataract surgery? Well, we all know that with social distancing, the queue will get longer and longer. You can expect consultations and operations to be further spaced out. You can also expect that many of the eye surgeons carrying out cataract surgeries will be busy addressing more urgent problems like macular degeneration and glaucoma, especially addressing all those patients who were unable to get treatment during the lockdown or decided against getting treatment during the lockdown. You can also expect that the NHS is going to experience significant funding deficits, and because a lot of resources have been put towards addressing the pandemic. And we can expect to see as well operating rooms and supplies to be in shorter supply than ever before. Now, if you've been wearing glasses for some time, you know how your eyes change as you get older, and you've likely got the on and off syndrome already. And now you've got the clouding of the natural lens in your eye that's also known as a cataract. And beyond simply getting your cataracts removed, many private patients can be free of glasses and contact lenses after private cataract surgery, and that's the reason why they go ahead and approach it this way. The interesting thing is that many people who go and have cataract surgery without looking at all their options have no awareness that they could, in fact, have one procedure which would get them out of glasses and contact lenses. And they're in fact quite annoyed when they realize that they missed this once-in-a-lifetime opportunity to, lie in a bed and get their cataracts removed. And instead of having a multifocal lens placed in their eye that would allow them to see at all distances with great comfort and without needing glasses for the vast majority of things that they enjoy in life, that now they have to just go back to glasses now that they have their cataracts removed. So as we age, we're becoming much more active, and we're remaining active for a longer time. And, the old days of needing to wear glasses are kind of something of the past. So we don't actually have to do this anymore. Glasses in the rain are a real hassle. We're seeing sunnier days now, but we all know how wet the English weather can be and how random it can be. And for most of us, especially today, we're using mobile phones, we're using screens for lots of things, not just work, but also for hobbies and for staying in touch with family. Having distance and reading glasses can be tricky. It's always misplacing them. And also varifocals have their own issues around balance and going upstairs and depth perception and things like that. You could fall asleep in your glasses. That can be annoying and dangerous. And of course, losing glasses is almost routine. I mean, the amount of times that I lost my reading glasses before I had my surgery and got them removed, well, I was spending more time looking for those than I was, thinking about what to do, in terms of getting it fixed. So absolutely, losing glasses can be a real hassle. And breaking and replacing them can be also very expensive, especially if you have a pair of glasses that's worth something like, 200, 300, 400 pounds. After a while, that can be a very expensive habit of breaking them. Now, putting in contact lenses has always been a hassle as well. And if you've lived with that for your entire life, you know how much of a hassle it is, but perhaps you've gotten used to it. But these days, touching your face, especially your eyes, can be highly dangerous and is considered one of those things that you really must not do unless you're very careful about washing your hands. And that's not so easy to do when you're outside and a contact lens slips or worse, falls out. Finally, sleeping with contact lenses still in your eyes can lead to a serious infection and something you certainly want to avoid. Now, let's hear from one of Mr. Hamada's patients who shares some of her struggles with glasses and contact lenses, and you'll get an idea as to whether or not there's some similarities between your experiences and hers.
Worn glasses since I was 12, and my eyes deteriorated my sight deteriorated quite badly over the following couple of decades, to the point where my glasses were quite thick lenses and not great to wear, very heavy. I went on to wear contact lenses, which obviously was a lot better. But along with contact lenses, you have the day-to-day routine of cleanliness, which does sort of take some thought. I did end up with some eye infections. And more recently, my eyesight deteriorated quite considerably. And I was offered vouchers by the NHS towards glasses, which I found quite a shock. So I decided to look into the various options, and laser treatment was obviously one of the options, but my eyesight was too damaged for sort of laser treatment. So I then progressed to looking into other options.
So what do you get after private cataract surgery? I'm sure that many of Mrs. Winfield's challenges before treatment would have resonated with you. Now let's look at the kinds of things that you can hope to experience after you have a lens-based procedure like she did. And certainly patients experience a great freedom from glasses and contact lenses. One of the best things that patients love most is that they don't have to worry about them anymore. And you know, that's especially true, as I said earlier, when, you know, if you want to remain active, it's you know, contact lenses can really get in the way of things that a lot of people enjoy, like swimming and like just doing any activities where there's any kind of wind involved, and certainly if there's any kind of, like, you know, at the beach with sand and things like that. So this is certainly something of a great advantage for those who get it. Quality of life generally improves. Patients experience a newfound freedom, many quality of life benefits. They tend to report a greater sense of ease and happiness, and they feel like their life is expanded before them. And, you know, imagine not having to worry about the hassles of glasses and contact lenses and just getting on with things that that you actually do enjoy. And of course, there's the cost savings, you know, not having to spend money and time buying glasses or contact lenses again and again and again. That's always nice to enjoy. And importantly, there's no need to wait months or years. Private cataract surgery patients can jump the queue and get freedom from cataracts faster than everyone else. And as I said before, that's going to become much more important now when the queues are getting longer. So let's hear from Mrs. Winfield now after she's had her treatment, and to hear what kind of advice she'd give prospective patients like you.
I would say definitely go ahead with it. I'll certainly look into it. It would obviously depend on the issues that somebody had, but if they were suitable for it, I would have absolutely no hesitation. Can't think why I've waited so many years to actually have it done. But it's definitely been life-changing for me. So thank you to all the team.
I'm sure that's a very common thing that Mr. Hamad and his team hear all the time is, I can't believe I waited so long to get it done. And that's always a nice compliment. Usually the idea of thinking about having cataract surgery tends to often be worse than the actual act of having it. But what might hold you back from private cataract surgery? Well, let's look at some reasons that people give, and also some questions that they ask. And I'll read the questions first, which are the more common questions that we tend to hear. And then I'll pass it over to Mr. Hamada and ask him every question in turn so that he can give his expert advice on what you should be thinking about when considering questions like this, if you also have them. So first of all, can you treat both eyes at once? Does it cure astigmatism? Will I ever need glasses again? Does private medical insurance cover private cataract surgery? How soon can I get back to normal life after cataract surgery? And is it safe, especially now during coronavirus? And how much does it cost? So, Mr. Hamada, if you could answer the first question, can you treat both eyes at once?
Oh, thanks, Rod, for the questions. Very frequently asked question by a lot of patients. So yeah, answering your question, if you can treat both eyes at once, let me start saying cataract usually affects both eyes. It's really less likely to see patient having cataract in one eye, unless it's disease-related or traumatic cataract. And really, modern cataract surgery nowadays is really very safe and effective. So the rate of cataract complication, for example, is really low. And an increasing number now of surgeons are offering simultaneous, or we call sequential bilateral cataract surgery. So in other words, cataract surgery performed on both eyes the same day. So why patients choose to have cataract surgery the same day, simultaneous bilateral cataract surgery? There are a lot of reasons. Usually the most common reason why patients choose that is convenience. So both eyes done and performed on the same day. obviously fewer office visits, a faster recovery of binocular vision, which is very important for driving, for other critical tasks, and actually quicker return to normal living. It is also helpful particularly for both patients with high prescription. So those are very long or very short sighted. So if you perform cataract in one eye or perform the eye separately, separate days, they probably feel visually unbalanced after first eye surgery. So those patients, they prefer or better for them to have both eyes done on the same day.
And does the surgery cure astigmatism?
Right. Very good question. So let me first tell you and define what is astigmatism. So in simple terms, the cornea or the eyeball shape is is oval rather than a round shape. And to have a perfect outcomes after cataract surgery, astigmatism need to be corrected, unless obviously the patient is happy to wear glasses to correct the astigmatism. So when we remove the cataract, and rather than using a standard monofocal lens implant, we use a special type of premium intraocular lens implant. We call it a toric lens or toric implant lenses. This is a toric lens work pretty much like a toric contact lenses, which correct the astigmatism. So that actually means it has a different powers in different meridians of the lens. Obviously, one big advantage of using toric intraocular lens to correct the astigmatism is that it doesn't move, it's pretty stable inside the eye. So positioned so secure inside the eye. And that's different to the toric contact lenses, which can move with every eye movement. So you get your astigmatism corrected, means that securely stable, means that long-term, the vision is sharp both for distance, if you chose monofocal distance vision with a toric lens implant, but also means that sharp vision for near if you chose a kind of those premium multifocal lenses which correct the astigmatism as well. And that's we call toric multifocal lens implant.
Okay, right. And I suppose that relates to the fact that many people don't need glasses in the future. Is that true?
Yeah, so that's what we want they ask. Said, can I be free of glasses? Will I ever need glasses again? And I always tell them, well, it depends. If you choose to have a standard cataract surgery with intraocular lens implantation, it's likely you will need reading glasses and possibly computer glasses. That if you choose to have a standard cataract surgery with a standard monofocal lens implant. However, there are other types of cataract options that patients might want. Those are an option that you reduce or sometimes even eliminate the need for glasses. In those cases, we use those, I said, premium lens implants, like the multifocal lens implant, the what they call extended depth of focus lens implant, which is kind of another type of multifocal lens implants. So this option obviously provide excellent outcomes that enable many people to be glasses free for much of their day. We have another option if you don't want to do multifocal lenses. Sometimes patients are either used for a special situation where one eye good for distance, one eye for reading, or they're not suitable for multifocal lenses. Here we use what we call a monovision cataract surgery. And it's quite a clever way to use a different target for both eyes. So where the power of a single vision IOL is customized in each eye so that expand the range of clear vision when the two eyes are used together. So in this scenario, what we have, the dominant eye will provide sharper distance vision and the non-dominant eye provides sharper near vision. Now, let's say modern cataract surgery can really eliminate the need for prescription glasses and read glasses by in almost 90% of the patients. So yes, there are options and it's a patient choice as long as they are suitable.
And what about private medical insurance? I mean, many people have that. Does that cover the cost of private cataract surgery?
Right, good question. Majority of private medical insurers will cover basic cataract surgery costs. That is the actual removal of the cataract and implanting a monofocal lens implant, a standard lens implant. And this is kind of like a NHS type cataract surgery. However, it will not cover, the insurance will not cover the premium lens implants, such as the one we talked about, the toric lens implants that correct astigmatism, or the multifocal lenses that give you distance and near vision. So therefore, with the private medical insurance, they cover alone and with no supplement, patients accept normally that they will need the glasses for near and intermediate vision, and sometimes actually for distance vision as well.
Okay, okay. And how soon can people get back to normal life after cataract surgery?
Right, so obviously recovery varies from a person to another. However, most people are able to return to work, to their normal routine of life within 1 to 3 days, but it could take 3 to even 10 weeks to get to the full benefit of surgery and for the eyes to settle completely and to see really clear as possible. So obviously we tell the patients about things to avoid, what's activities they need not to do in the first couple of weeks. Also give them some advice on how to minimize the risk of eye infection. And a patient normally sent home with a clear plastic shield on the eye. This is really to keep from rubbing the eyes. Also patient given eye drops to use until the eye completely healed. Usually drops used for 4 weeks. The fact that the eye is recovering doesn't mean you cannot watch TV, you cannot live normal life. In fact, patients are encouraged to go back to normal life, like watching TV straight away and do things they want to do without any kind of excessive movement to the head, especially first week or 2. And we tell them that the things might look a little bit blurry initially, but then things start to sharpen gradually.
And is it right now a good time to have cataract surgery? I mean, is it safe even with all of this virus going around? Is that okay?
Yeah, so in general, cataract removal is an elective procedure. And the advice was to postpone doing elective surgery during the COVID pandemic. There are some exceptions, obviously, that are considered urgent, say those cataract that you have to remove because to avoid complications, like angle closure glaucoma. So if you leave the cataract, there is a high risk of raised eye pressure in the eye, or the cataract result from the eye injury that needs surgery, etc. So, but now we are getting into post-COVID recovery, and where we will start doing cataract surgery operation very soon again. The priority is to ensure safety of patients and staff, and also this is the main thing, but also we want to identify those patients who are at risk. So we will be, for example, asking patients extra questions related to their health and those in their household. We'll be asking patients to fill a special medical questionnaire about their medical history, there's a lot of questions the patient are asked to do at home before they come to their actual visits. And part of the consultation will be done through our virtual clinics now, and the video consultation, where we bring patient to clinic only to have scans and maybe measuring the eye. And so we minimize the visits to the eye center as much as possible. Really our aim to create and keep our clinic and operating theaters COVID-free at all times. We have a new patients pathway. Well, that's to ensure really the process is safe, is effective. So for example, we'll ask the patient to wear a mask, facial mask, during the duration of the visit, and there will be reduced capacity during waiting area, for example. So there's a lot of changes to the normal path, and we like to call it the new normal. It's all really for the safety of patients and our staff.
Yeah, I'm sure patients will be very reassured, because I think, you know, especially while things were going on, they were quite wary, naturally, of going into anywhere near a hospital. Absolutely. But as you've obviously put in all the measures that are necessary in order for people to feel comfortable and also to remain safe.
Sure, yeah, exactly.
So do you see my screen again?
Yeah, I can see everything.
Okay, perfect. So I want to address the question of how much does it cost? And I think that's an important question, and we want to make sure that people go in eyes open. Obviously, surgery on the NHS is at no cost at the point of surgery. However, if you want to go into the private route, then clearly there is a fee associated. I wanted to share with you what the private cataract surgery prices are. If you want to have standard cataract surgery in London, so in other words, if you wanted to just simply jump the queues and you were fine with your glasses, you were fine with your contact lenses, you didn't feel that they got in the way of your lifestyle, and if or for any other reason, you've considered private cataract surgery with a multifocal lens, and for whatever reason you're not suitable, then this might actually be a good route for you. Essentially, what you get is a secured spot on a much shorter waiting list. I mean, considerably shorter waiting list. In fact, Mr. Hamad is already seeing patients for this, and the clinics are opening. They're fully staffed, and they're actually ready to go, as he was explaining. Obviously, you get the cataract extracted from your eyes, so you end up with clear vision. Your lens will be replaced with a monofocal IOL, and as Mr. Hamad explained, this is the lens that provides you with the vision at a particular distance. You may still, obviously, because of that, require glasses for near vision. However, as Mr. Hamad explained, he could put in one lens that's more suited to distance and one lens that's more suited to near vision, in order for you to if you're compatible with that, and if that you're suitable for that, then you're able to kind of switch back and forth a little bit more easily. And certainly you would probably require glasses for distance if you have astigmatism. So if you have any of those things, if you already wear glasses and they're a big annoyance, or if you have astigmatism, then or contact lenses, then it might be something that you really want to consider to go in the other direction. But for now, if you wanted to have that type of surgery in London, and locations outside of London may incur a different charge, but in London, it's 1,995 per eye, and that is something that is considerably less than what is available in most locations in London for private cataract surgery, and it's a particularly advantageous price, mainly aimed at providing an alleviation of some of the waiting times that many patients will have to go through. It's essentially a very similar service. However, you get to choose a surgeon, which is also helpful, and you get to see him at various parts of the pathway. But that's the price for that. Now, if you were looking at a premium refractive cataract surgery, for example, if you really do dislike your glasses, if your contact lenses are very much in the way of your lifestyle, then what this affords is the same spot on that waiting list, which is again much shorter than you can than you have to look forward to on the NHS. The cataract extraction, and then your lens will be replaced with a multifocal IOL. And again, what this does is it enables you to be free of glasses and contact lenses for 90% of the activities that you go about doing, whether they're, whether it's knitting, or whether reading a book, or looking at an iPhone, or whether it's, being outside and enjoying nature and all the beautiful bright colors that you'll end up seeing after you have your cataract surgery done. So it'll also address your astigmatism. So if you have any double vision or any symptoms of astigmatism, it should address that issue. And of course, you'll get a surgeon-led pathway throughout. So you are guaranteed to see Mr. Hamada before, during, of course, and after for all the supplementary post-operative visits as they're required. Now for that, there's a range, because we obviously don't know what lens you'll qualify for or what lens would suit you best. But it's between $2,500 to $3,850 per eye. Obviously, that's a significant difference from what's available for standard cataract, but the good news is that you're unlikely to need anywhere near the amount of glasses or contact lenses that you would otherwise have to spend money on well into the future. So that's one of the reasons why people choose to go this route. And on top of that, you get the benefits, of course, of everything that your glasses and contact lenses were able to give you. You're going to get the benefits of those, because you can now see clearly at all distances. Now, there's no need to decide right now. That's not what this is about. Really, what we're doing at this moment is is really trying to understand if you're a candidate. And if we can do that virtually, then all the better. So you can feel confident that you'll be meeting Mr. Hamada to have a conversation with them from the safety and comfort of your own home. We could do this virtually. So there's no need to come in to see if we can help you. Of course, eventually you will have to go in and see Mr. Hamada to get some tests and exams to ensure that he can properly plan the treatment and that it's all safe. But yeah, we can start this process virtually if you wish. If you wish to schedule a video appointment with Mr. Hamada, then there's an easy way to do that. You can either call the number that's on the screen right now, or you could go to the website at icliniclondon.com, and there's buttons that look like that where you can book a consultation. They're everywhere, so you'll definitely see them. Or if you want to be fancy, you could just take out your mobile phone, open up your camera, and take a picture of that device or that QR code there, and it'll take you directly to the book a consultation page on the iClinic London website. So that's an option if you wish to proceed along that route. Now, I wanted to talk to Mr. Hamada and get him to explain his story a little bit. We've got a lot of biographical information online already, so you're more than welcome to read that. But for now, what I'd like to do is I'd like to get Mr. Hamada to introduce himself and to tell us a little bit about how he became an expert in cataract surgery.
Oh, thank you, Rod. Okay, you want me to tell you my story? Okay, so well, this is my story in cataract surgery, basically. During my training in ophthalmology, I was really privileged to work with amazing surgeons who taught me how to become a competent and safe surgeon. So my skills in cataract surgery excelled throughout my fellowship training, where I performed highly complex cataract surgeries in a newborn, in smaller and older children, as well as those with high risk adult cataract surgery. This was not enough for me. So I did a master's degree in cataract and refractive surgery from Ulster University, and I got my diploma with honor degree. I always thought cataract surgery as a refractive surgery, and it's an opportunity to give a patient the one-in-life chance to be free of glasses. Therefore, I was one of the first in the UK actually to start using premium lenses like the special multifocal and extended depth of focus intraocular lens implants. I have written more than 2 book chapters about cataract surgery in adults and children, among many other peer-reviewed articles published in international scientific magazines. I sit also on the Council of United Kingdom and Ireland Cataract Refractive Surgery Society, and I'm passionate about teaching, education. I teach my fellows how to manage complex cataract surgeries and also how to avoid or manage complications should it happen or occur. I'm constantly invited to speak at various national, international conferences worldwide. I really pride myself that I have restored the eyesight to thousands of patients of all ages. Patients praise me for being a trusted and caring eye doctor. So I hope that summarizes my story in cataract surgery where I am now.
Definitely, that's great. Yeah, and I think actually on that last note about patients praising, I wanted to share a little bit about what some of those patients say. Can you see the screen okay? Is everything fine?
Yeah, that's fine.
Great. So I'll just read some of these out to you. These are some testimonials from Trustpilot. And as you can see, Mr. Hamada has a 4.8 rating out of 5 based on 103 reviews. No doubt that's increased since we've took that picture. But here's what Sam Brock had to say. What a consultant. Dr. Hamada is a man who was born for this profession. As soon as we walked into the room, you felt that you had met a man who was gentle and kind. His demeanor was of a man who knew his trade. He speaks in a way that you will understand, and he explains exactly what is wrong and the way he will help fix it for you. So that's sort of lovely words. Certainly what I'd be looking for in a doctor myself at any time. Timothy Thompson says, Mr. Hamada's London Eye Care and his team are a delight. Nothing was too much trouble, and the help, support, advice, and guidance before, during, and after the surgery was all world class. I've worn glasses since the age of 13 years. and had the onset of cataracts for the last 5. So it's all been very life changing, and to be free of those glasses once more. So that's lovely as well. Good for him. And Amy says, I would not hesitate to recommend Dr. Hamada and his team from the first call to inquire about booking an appointment to booking it. I was so impressed, and his wonderful secretary, Joanna. She's really worth her weight in gold, and her lovely manner and care made me decide to go for this clinic. So that's lovely. Dr. Hamada was a lovely man with a very kind and thorough way about him. He put my 4-year-old daughter at ease, and the appointment was lengthy, but at no point were we rushed, and able to ask as many questions. Things were explained really, really well. So I'd have no hesitation at all to recommend anyone to use Dr. Hamada and his team. I have already recommended him to some of the other parents. So that's wonderful too. Yeah. So again, look, I invite you to meet Mr. Hamada yourself, and you're able to do so with a video consultation. Again, you can go online to the website at eyecliniclondon.com, and you will be able to find some of the quickly moving appointments. He's in great demand, and a lot of people wait a long time to see Mr. Hamada. But at the same time, he's made some dates available again to alleviate some of these NHS queues. So you'll be able to see the most current dates online, and you'll be able to actually book right online if you wish. There's actually even no need to call. If you like, you can use your phone and take that out, and you can see there the QR code. And if you want to open up your camera and click it when it tells you to, you'll be able to actually go and go right to that page where you can book an appointment. I'd like to also hear from Ms. Annabelle Giles, and perhaps it'd be great if Mr. Hamada, if you could tell me a little bit about your experience with her, and before I play this video, give me a sense of what it was that you were treating her for.
Of course, of course. Well, Annabelle, she had a condition called Stevens-Johnson syndrome, which meant that her eyes were extremely dry, as well as having a special prescription. That all meant that her cataract surgery was not a straightforward one. So additionally, she wanted to be free of glasses. So really a lot of work and preparation needed to treat her dry eye and to control the inflammation in her eyes ahead of the surgery. Surgery was done successfully, and she restored perfect vision, both for distance and for near. She was free of glasses and contact lenses for the first time in her life, and showed excellent recovery. So this was many years ago, and until today, she's enjoying an amazing vision, as you can hear from her now.
I have to say, Mr. Hamada is a safe pair of hands, the safest pair of hands, because I'm a bit of a fusspot, and occasionally I've rung him up going, oh, I don't know what I'm going to, and he'll just say, no, it's all right, come and see me. He always makes time for me. He's highly professional. He's always at conferences around the world telling other people how to do what he does. I feel really at home with him. He remembers what I do for a job and, the name of my children and all that. He's an all-round brilliant person, and you're not just going to trust your eyesight to anybody, are you? You're not just going to go, do what you like, let's see if it works. I absolutely sort of checked him out as a person, actually, and he's a really good, decent person. I've no idea when he sees his family, by the way, because he works really hard. Apparently he does. But I just think he's lovely, and I feel completely safe. And if I ever get any problems, I would always find him. Even if he changes country, I'll track him down.
So I hope you've had a chance to see your family in the last 2 months, Mr. Hamada. I'm sure there's been a bit more time for that. So great. Look, thanks very much. And we'd like to invite you to schedule a video appointment with Mr. Hamada again. So you can take the next step towards skipping the cataract surgery queues after lockdown. Like I said, you can either call the number that's on the screen right now, or you can scan the QR code. That's perfectly fine too. It'll take you right to the book an appointment page. And if you're watching this webinar on demand, you'll see an online scheduler below where you can book the best time for your consultation. And Yeah, that's all for us. So I'd like to say thank you very much to you for staying with us, and I hope that you stay safe. And Mr. Ahmad, if you'd like to say goodbye, that'd be great. And we'll wish these folks a good day.
Thank you, Rod, for all that. Can I just last few words, really? I just want to say, and I can say that because it's proven by multiple studies, that cataract surgery is not only about restoring vision, but the translation of vision improvement into considerable gains in real life activities, emotional and social life components. So most of my patients tell me they wish they had their surgery a long time ago. And you may want to delay cataract surgery because you feel that it's still okay, I can manage, but you might not realize that your quality of life has started to deteriorate because of the cataract. So for example, driving at night or struggling to read unless you have a bright light, all that means the cataract already developing. And obviously a combination of highly advanced technology in a world-class facility that we have here in central London, amazing team I'm proud of, and a skilled caring eye doctor myself, and you will be sure that your eyes will be and are in safe hands. So really at the end, I just want you all, thank you all, thank you Rod and my team for making this webinar. Thanks you to those who listen to the webinar, and I hope to see you soon.
That's great. Thanks very much.
Thank you.
Bye-bye.
Bye.